My name is Charles Fakrua. It is the time for when we talk about health and wellness. Well, before we go into today's topic, my heart goes for all those flawed victims in the various parts of the country. And we must also thank a presidential aspirant that made it so open that other people should. He stopped his own campaign and advised other presidential aspirants to also stop their own campaign. And we've seen them going to visit this victim and donating some money. We need to show empathy for our people. So today we'll be looking at one aspect of our health today in the workplace, which is not too common, but we have seen people who suffer those kind of injuries. And of course, I am dedicating today's program to survivors of what I call brain tumor. So people will say brain cancer. But today we're looking at brain tumor. What is brain tumor? The primary brain tumor, secondary brain tumor. What are the causes of brain tumor? Can it be prevented? What are the signs and symptoms of this brain tumor, as the case may be? Who is supposed to treat us? Can we prevent it? If we can, what can we do? And how to live well with brain tumor. Yes, today's program is basically a form of education, so that when you are diagnosed that you are having brain tumor, that's not the end of the life. So, and brain tumor is not the same thing as brain cancer. So brain tumors can be malign, that is cancerous, or benign, non-cancerous, and can affect children and adults. But whether they are cancerous or not, brain tumor can impact your brain function if they grow large enough to press on surrounding tissues. These are several treatment options for brain tumor. So once you have a tumor growing on your brain, whether it is cancerous or not cancerous, it can be a problem for the individual. So what is a brain tumor? A brain tumor is an abnormal growth or mass of cells in or around your brain. Together, spinal tumor and brain tumor are called central nervous system, because we know it is the brain and the spinal cord that makes up the central nervous system. So brain tumor, like we have said earlier, can be cancerous or benign. Some tumors, that's the non-cancerous ones, they grow quickly while others are slow growing. So only about 1/3 of brain tumor are cancerous. But whether they are cancerous or not, brain tumors can impact brain function and your health if they grow large enough to press on surrounding nerves, blood vessels, and tissue. So we should not say because it is not cancerous and it is not dangerous. It's a tumor that is not supposed to be there. So tumors that develop in your brain, we call those ones, they develop in your brain, they are called primary tumor. While tumors that spread to your brain after forming a different part of your body are called secondary tumor. But today we will be looking basically at primary brain tumor. Maybe the oncologist will, when it is cancerous, that's where we need to call the oncology. But for now, I'm sure the neurosurgeons can do the job very well. So what are the types of brain tumor? There are different types of brain tumor, a lot of brain tumor. So we're not going to look at those ones. We'll leave that for the medical people to look at it. We just want to give an education about brain tumor. Who do brain tumors affect? Brain tumors affect children and adults, as I've said, and can develop at any age. They are slightly more common in people assigned those who are male, than female. So you can see that men are more prone to brain tumor compared to women. Yeah. How common are primary brain tumors? Primary brain tumors, that's a tumor that originates in the brain, are uncommon. Only about 5 per 100,000 people are diagnosed with primary brain tumor each year in the country. or let's say even in the world. But that is the statistics. Okay. How serious are brain tumor? How serious? Brain tumors, whether cancerous or not, can cause serious problem. This is because your skull is rigid and doesn't provide room for the tumor to expand. Also, if a tumor develops near part of your brain that controls vital functions, it may cause symptoms such as, of course, weaknesses, difficulty walking, problem with balance, partial or complete loss of vision, difficulty understanding or using language, and of course, memory issue. Brain tumor can cause problems by directly invading and destroying healthy brain tissues, putting pressure on nearby tissue, increasing pressure within your skull, causing fluid to build up in your brain, blocking the normal flow of cerebrospinal fluid through the spaces within your brain, causing those spaces to enlarge, causing bleeding in your brain. However, some people have brain tumor that never cause symptom or grow large enough to compress surrounding tissues. So what are the symptoms and the causes of this tumor? What are the symptoms that we need to see? What are the signs and symptoms of brain tumor? Because that is where we are interested in for the average worker. What are the signs and symptoms of brain tumor? Some people have a brain tumor experience, no symptoms, especially if it is very small. Signs and symptoms of a brain tumor can vary depending on the tumor's location, the size, and of course the type. So what are these signs? Headaches that may be more severe in the morning or wake you up at night. Let us look at these symptoms critically. Headaches that may be more severe in the morning or wake you up at night. 2. Seizures. Difficulty thinking, speaking, or understanding language. Personality changes, weaknesses, or even paralysis in one part or one side of your body. Dizziness, balance problem. You can also have vision issues, hearing issues, facial numbness. In fact, in some cases, nausea and vomiting, confusion, disorientation. These are some of the symptoms. I'll tell the symptoms again. Headaches, seizures, balance problem, dizziness, paralysis, vision issues, hearing issues, facial numbness, nausea, or even vomiting. It is important to see your healthcare provider if you are experiencing these symptoms. So what causes brain tumor? What is the cause of brain tumor? Well, medical scientists, researchers know brain tumors develop when certain genes on the chromosomes of a cell, as the DNA, are damaged and no longer function properly, but they aren't sure why this happens. Your DNA in your chromosome tells the cells throughout your body what to do. It tells them when to grow, when to divide, multiply, and even when to die. So when brain cell DNA changes, it gives your brain cells new instructions. Your body develops abnormal brain cells that grow and multiply faster than normal, and sometimes live longer than normal. When that happens, the ever-growing crowd of abnormal cells takes over space in your brain. In some cases, the person may be born with changes in one or more of these genes. Environmental factors such as exposure to large amount of radiation from X-ray or previous cancer treatment may lead to further damage. So we can see, yes, researchers are not too clear about the cause of brain tumor, but we have been told that from our DNA, our gene, Then we've also seen that also being exposed to radiation from X-ray. In other cases, the environmental injury to the gene may be the only cause. There are a few inherited cases, from parents to children, genetic syndromes that are associated with brain tumor, include them. There are so many of them, So we can see the causes of brain tumor now from the genes, our DNA, from the environment, exposure to X-ray, and of course, some rare cases, it's genetic. However, only about 5% in terms of people with brain tumor have a family history of a brain tumor. So we cannot conclusively say it is hereditary, but there are cases, about 5 to 10%. How do we diagnose brain tumor? And how do we do the tests? Diagnosing a brain tumor can be a complicated process and may involve several specialists. Of course, I've mentioned the neurosurgeons will have to be there, and of course the neuro-oncologists, will also have to be there, and of course other healthcare practitioners. In some cases, though, healthcare providers may discover a brain tumor when performing imaging tests for another medical issue. If you are experiencing symptoms of a brain tumor, your healthcare provider will perform a physical exam. They will also ask questions about, the symptoms you are going through, your past and current health conditions, current medication, surgeries and medical treatment, of course, family medical history. They may also perform a neurological exam, which involves looking for changes in your balance, coordination, mental status, hearing, vision, of course, your reflexes. These changes can point to the part of your brain that will be affected by the tumor. Now, if your health care provider suspects you may have a brain tumor, a brain scan, most often the MRI, magnetic resonance imaging, usually the next step. So for the medical practitioners, you understand what is MRI. So what tests will be done to diagnose a brain tumor? Healthcare providers use several tests to diagnose a brain tumor, including the brain MRI or CT scan. That will be done. We also have biopsy, where a neurosurgeon may perform a biopsy during surgery in which they remove part of the tumor, to go and test. That is the healthcare provider usually need to do a biopsy of the tumor as a removal of a sample of tumor for examination under a microscope to identify the type of tumor and if it is cancerous. That's what they will do. Then they can also do specialized tests. Certain tests can sometimes help with the diagnosis. For example, your healthcare provider may order tests that check your blood and cerebrospinal fluid for substances that certain tumors release, called markers. They can also test for gene abnormalities that are characteristics of a brain of certain tumor. Management and treatment. Brain tumor treatment depends on several factors, including the tumor's location and the size and type, the number of tumor, your age, and of course your overall health. The non-cancerous brain tumor can usually be successfully be removed with surgery, and those usually grow back. It often depends on if your neurosurgeon can safely remove all the tumor. Treatment that are fairly well tolerated by the brains of adults, such as radiation therapy, may prevent the normal development of child's brain, especially in children younger than 5. So, healthcare practitioners often use a combination of therapies to treat a tumor. Your treatment option might include, of course, the brain surgery, which is just the surgery, and some experts will call that the craniotomy. Craniotomy. That is one. Of course, radiation therapy can also be done. Then radiosurgery, chemotherapy, immunotherapy, and of course targeted therapy. So these are some. Of course, they can also use drugs such as the mannitol, and of course corticosteroid. These medications can help reduce pressure within your skull. They reduce swelling around the tumor. They can also do some palliative care. This is a specialized form of care that provides symptom relief, comfort, and support to people living with serious illnesses. It also provides support to caregivers and those impacted by loved ones' condition. How do we prevent brain tumor? That is the question we want to be asking ourselves. Unfortunately, you can't prevent a brain tumor. You can reduce your risks of developing a brain tumor by avoiding environmental hazards such as smoking and excessive radiation exposure. So you can see why Surgeon General keeps saying smoking is dangerous to your health. Smokers are liable to die young. So stop smoking, then avoid unnecessary environmental hazard, excessive radiation exposure. If you have a first degree biological relative, maybe your sibling or a parent, who has been diagnosed with a brain tumor, it is important to tell your healthcare provider. They may recommend genetic counseling to see if you have an inherited genetic syndrome that's associated with brain tumor. Yeah, what's the outlook for brain tumor? The outlook for people with brain tumor varies greatly. Factors that affect the outlook include the tumor's type, grade, and location. If the whole tumor has been surgically removed, your age, and of course your overall health. In many cases, healthcare providers can successfully treat a brain tumor. Some people live active and fulfilling lives with brain tumor that don't cause symptoms. For some people, brain tumor can recur. That is the return after treatment. If this happens to you, you may need to continue treatment, including chemotherapy or radiation, to keep the tumor from growing or spreading. So in the workplace, people can be treated successfully for brain tumor. They will come back, and of course, they can live a normal life. But you need to be in touch with your healthcare provider. So what is survival rate for brain tumor? Survival rates are different for each type of brain tumor and vary based on your age, race, overall health. Survival rates I estimate based on average. The 5-year survival rate tells you what percentage of people live at least 5 years after they are diagnosed with a brain tumor. The 5-year survival rate for different types of, like in case of meningioma, the most common type of benign, that is non-cancerous primary brain tumors, are over 96% of children aged 14 and under, they survive. 97% in people aged 15 to 39. Over 87% in adults 40 and older. Survival rates vary widely and depends on several factors. So you need to talk with your healthcare provider about what to expect with your diagnosis. What should I see? When should I see my healthcare provider about my brain tumor? If you have been diagnosed with a brain tumor, you will need to see your healthcare team regularly to receive treatment and monitor your symptom. You should see your healthcare provider if your brain tumor symptom gets worse or you have new symptoms. So you should be able to take care of it with the guidance from your healthcare provider. So what are the certain questions you should be asking your doctor about a brain tumor diagnosis? If you have been diagnosed with a brain tumor, it may be helpful to ask your healthcare provider the following questions. Is the tumor malignant or benign? Of course, whether it is cancerous or not. What kind of tumor do I have? What type of treatment is best for me? Will my treatment cause side effects? What type of specialist will be part of my care? What is my diagnosis? Are my family members at risk of developing a brain tumor? Do you know of any person or any group? Because you need to look for survivors of or those who have been diagnosed, so that from you can have help from them, and of course encouragement. So on a final note, brain tumor is not a license, it's not a dead warrant. Once you are diagnosed with it, it can be treated as long as you are seeing your healthcare provider. They will advise you as to what to do. So learning you have a tumor in your brain, it can be very scary and stressful. Not all brain tumors are cancerous, though in fact about 2/3 of them are non-cancerous. However, they can still cause problems for your brain. Know that your healthcare team will develop an individualized and thorough treatment plan to help treat the tumor and improve your quality of life. You can return back to your workplace. You can begin to do your work the way you used to do it. Having diagnosed or learning that you have tumor in your brain, it is not a death sentence. You can come back and live a normal life as long as you take all the advice, you follow all the instructions of your healthcare provider. Thank you.